My name is Dr. Omondi Ogude. I'm a specialist physician and medical oncologist at the Sandton Oncology Medical Group. We're based in Sandton. We also do work with the Ahmed Kathrada Cancer Institute in the south of Johannesburg. I've been in the profession now for about just around 67 years in medical oncology itself, and I worked in internal medicine as a specialist physician prior to that. So oncology is a broad field, and it's a field in which we study cancer and the mechanisms that cause cancer, but also we study how we can treat and manage cancer. So it's an all-encompassing field, a developing field, a dynamic field that's growing throughout the world and is of increasing importance because of the increase in cancer as such worldwide. So, I mean, in terms of cancer statistics, they're quite high, and they largely go unrecognized because of the registry in the country is not as well organized as it should. It is being developed and worked on. However, the estimates now are about between 1 in 4 and 1 in 5 patients, or 1 in 5 people in the population will develop one or other form of a cancer. Which is quite a worrying statistic. So it means a quarter of people out there will at some stage in their lives develop cancer. Top 5 cancers. So I think with cancer, the best way to categorize it is to look at it from a male and female perspective. And starting with the females, the most common cancers in females are breast cancer and cervical cancer. Cervical cancer probably being the most prominent one, partly on the back of the fact that it's associated as well with HIV and AIDS. So there's an increased incidence in this population. However, having cervical cancer does not mean that you necessarily have AIDS, but there is an association and a high increase in that population. Also, breast cancer, of course, is the second most common, as well as colon and lung in females. In male patients, prostate cancer being the most common, as well as lung cancer, followed closely by colon cancer being the most common cancers in the population. Sure, that's a broad question. So it really depends on the cancer, and there's a big scope of cancers, but by and large, the biggest group at risk are those that are older. So the older you are, the more likely you are to get cancer. Cancer is basically developed, so it's a function of some sort of mutation in your DNA that happens with age as your DNA degenerates, and you're more likely to develop these mutations. So therefore, as you age, statistically speaking, you're more likely to develop cancer. Other factors include risk factors that we all know about, such as smoking, excessive amounts of alcohol, poor diet, and of course your genetics probably play one of the biggest roles in terms of your risk of cancer. So if you have somebody in the family with cancer, and usually that's in your immediate family, there's a much higher risk of developing cancer as well.